excited that Ben's here. I've known Ben since an embarrassingly long time. Probably won't even say how long I've known Ben. But I was really excited when I gave a talk at CHOP and talked to Ben afterwards, and I wasn't even aware then of all the work Ben had done in this area having to do with just helping more young adults who are entering into adulthood, into transitioning and understanding them better. So he's going to talk to us today about his Passage program. And I'll just leave it at that. But Ben is an associate professor at CHOP. So yeah, you're at CHOP in the University of at UPenn. Is your main appointment then at UPenn? Is that right?
Yeah, so CHOP essentially serves as the pediatric department for the University of Pennsylvania's School of Medicine. So yeah, all of the faculty appointments are through Penn, but I'm based at CHOP.
Excellent. So I'm going to turn my camera off and pass on to Ben. I
Sure.
will kind of give Ben a warning if he's still going at about 10 minutes to the hour, so that I'll turn my camera and let you know that we got about 10 minutes left. So if people do have questions or whatever, but feel free to put your questions in chat and we can always send those questions to Ben later to answer them. So Ben, over to
All
you.
right, thanks. All right, I'm going to share my screen, and I know that as soon as I do, I will be able to see nothing. So I'm just going to ask one person, anybody, whether it's Courtney, Steve, somebody, just once I get my presenter view up to make sure that you are seeing,
Yep, you got the right view, Ben.
you can see the slides. And
Yep.
is it the regular view? It's not the
It
presenter
is
view?
the correct view.
All right, awesome. Okay, so I'm going to talk about the Passage program. So everything that will come in November and December, this is not that. Um, and I'm going to sort of just try to span talking about what we're doing clinically and then sort of highlight how we're integrating research and training all in one program. Um, and I think I cannot get my slide to advance, apparently. Awesome. Oh, there we go. So our vision within our Passage program is we really want autistic teens and young adults to receive supports and services to achieve the quality of life that they desire. Um, and so that's our vision for the world. And what we view as our mission within the Passage program is we want to develop the knowledge, we want to develop that knowledge and resources and identify supports or create supports that will assist them to actually achieve that mission, that vision of being successful in adulthood. And ultimately, and one of my team members who I know is on the call today, Dr. Kaplan Khan, she often says like thinking about this as like preventative medicine, preventative care. Like we want to prevent the service cliff. And so, oh, that was fun. And so we think that it was fun that the picture disappeared. That was not my goal. But we do think that like a successful transition is really about balancing investments in both a person's independence and their well-being. And this really comes from honestly an interaction I had with a program officer at NIMH a few years back now, where I was talking with them about a grant that I'll talk about later, where I said like we were really invested in sort of supporting quality of life. And I was told that from a programmatic perspective, they only cared about objective markers of quality of life. Like, do you have a job? Do you have a place, are you living independently? And we were really, as a team, very invested in the subjective. And we sort of got into a little bit of a discussion about the value of subjective, because someone could have high subjective, but they could not be very independent. And so where we settled on, because our group felt very strongly about the importance of subjective quality of life, is that you really want to balance those two together. It's not just important that maybe an autistic person who wants to work has the job, but they actually enjoy it. Because if they have a job and they are experiencing severe burnout and are unhappy, that's not great. And that's not just true for people who are autistic, it's true for everybody, right? That's not a great quality of life. So this is sort of our mission within the program. And I just want to take a quick pause to say, the work we're talking about today, we've gotten a really nice support here at CHOP. And so the Passage program came first, and there's the acronym. I'm not saying it out loud because it's too long, but we love Passage. But we were able to get a center focused on transition in the Department of Psychiatry here. And that stands for Advancing Transition and Learning for Adult Success Center, or the Atlas Center. And we have multiple programs sort of serving different groups. So Passage is autism. The Flight is for a collaboration with the Armelino Center at Penn and CHOP. where they're focused on Williams syndrome, and then the Forward program, which is just getting launched, which is going to be focused on IDD populations. So in thinking about the structure of the Passage program, and because that was our first, we're trying to model the other programs off of this. We really want an investment across these three areas, sort of really integrating. So research being informed by, training that's happening either in the community or with other professionals, and clinical work, and vice versa. So that way they're sort of a really integrated flow. And hopefully I'll be able to show you what we're doing to sort of give you an idea of how we're actualizing that this model. So first, I want you to meet the team. This is our clinical team, and I have to say, I am the one giving the talk today, but what I am representing is a work, like a collected works from just incredible people that I get to work with every day. We have a fantastic clinical team. It's interdisciplinary. And you'll hear a little bit about the model today, but really, this is not my idea. Like I had some ideas. I started working with Susanna Reimer on this 4 years ago, and we had a postdoc at that time, Dr. Ellie Kaplan Khan, and then we had an intern, and Dr. Ariana Garagozo, who came in and postdoc and now stayed. And they have been just driving forces. And then after that, Dr. Katz came on board and works with us for part-time, and Miss Jenere, and each person, they come in, like they add their piece to what we're doing. And I just think it's really important for me to state how much of this is a collective impact. It really is growing out of this interdisciplinary collaboration. So just want to say that. And I will do my best. In the clinical program, it'll be maybe a little trickier to sort of talk about how these come out, but certainly in the research programs, I will highlight people. And this is the research group, which has overlap with the clinical. And some people are partners, like Dr. Ali Curry, who's in our Injury Research Prevention Center. She and I have been working for a number of years on transportation research, which is very yoked in, and as well as quality of life. But other people on this list are people that have contributed to the research that we'll talk about. I also just want to highlight two people. I want to highlight Miss Deborah Dunn, who is a parent and sort of is a consultant to our program, who really helps keep us grounded in the community. And then I also just want to highlight, even though she's not with us, I'm having Miss Escobar Gomez on here because she really helped getting up our R01 and was just a huge force in some of the work that I'll talk about later. So even though she's moved on to graduate school, still wanted to acknowledge her work. So I'm going to start with the clinical program and spend probably more time talking about what we're doing there for this group, but I'm happy to answer anything in questions. So within the clinical program, we serve 16 to 25-year-olds. And what's new and what I'll focus on is our transition consultation clinic. Other pieces I'll touch on, but I don't know if it's different in other areas of the country or where you are, but in Philly, it is really hard to get an autism diagnosis for people once they hit 18 and up. So this is one area so for new autism diagnosis, there's nothing special in that. It's just that we're providing that service, which seemed to be needed. But the transition consultation clinic really came out of surveys with the community and providers of like what they wanted. And our model has changed over time, but to highlight what we're doing now is when people come in, if they have an established diagnosis of autism, they have an initial sort of consultation session or the beginning of a therapeutic relationship with one of our social workers. And the goal there is not case management. It's not just like, hey, here's the phone number, call this. It's really about saying like, okay, you're entering adulthood. Where are you? What are you going to be wanting to do in your life? And starting to get a sense of what they're thinking about and then helping them problem solve. So we refer to this as solution-focused therapy, but start to problem solve, like, what are your choices? What seems like the best choice? To help people sort of figure that out. And we offer people roughly 5 sessions over the course of a year, and then sort of like an annual follow-up after that. And after that initial session, if it's determined by the team or the social worker that there's a need for psychological evaluation, they come to us, and we'll talk about what goes into that. it was largely driven by some regulations in the state of Pennsylvania about like who can access certain government services and how recent testing needs to be. But there's also sometimes like if there's concerns about maybe undiagnosed mental health conditions or other factors that just sort of need to be understood. And then they sort of go back to social work to continue the work. So we think about it as like a referral, we do our work, and then they come back to people. Um, the plan is created collaboratively with the family and the young adult. And I want to stress, and we really sort of direct the clinical service to the young adult, and even to the teenager as much as they want to be involved in that and as much as they are interested of like taking lead on this. And one of the things we really like to do as we create sort of like I think about the psychology service to some degree as sort of creating a framework for a transition to adulthood plan. And then the social work component is actually helping them make their choices and begin to implement. And we really, over the course, whether it's, if they're working just with the social worker or if they come to psychology, we really try to separate out like what's priority. So like, what do you want to do this year? And then what's maybe longer term? Because we know if we're talking to an 18-year-old, a 19-year-old, 20-year-old, we can't have a forever, plan, right? Like we have a horizon that's maybe going to last 2 or 3 years, and then there's going to be updates. Things will change in that person's life. Maybe they've attempted certain things and they've decided well, they want to make a shift. Maybe they do want to go to college. Maybe they don't. Maybe they do want a habilitation program and not work. So we really sort of recognize that this is, the one constant in this age is change. And so we really try to select like, what do we feel confident we'll do this year? And then we can return to some of the longer term recommendations. So within the consultation clinic, we decided one of the first things we had to do was create a model of like, what are the domains we want to evaluate? And I want to say that there is nothing that is earth-shattering about this model. And here, we tried to break it down into questions that we would want to ask our families, that we would want to follow up with them on. And these are not anything that like any of you as thoughtful clinicians, if you work with teenagers or adults, that you wouldn't be thinking about on your own. But we just wanted to have something to guide us so we could be thinking about it. And really with the lens of like, these are the things that are going to make somebody have a better quality of life. If we can answer these questions and feel like we have a plan and help families feel like they have a plan. Because most of the time, at least for me, before I started this program, I had families coming in saying, what's my child going to do? Or the person would say, what am I going to do? Or they'd say, where am I going to live? And then they would be like, what am I not thinking about? It's sort of like, I don't know what I don't know. And so we try to think about having a model that covers that. So I'll go through these and not try to belabor them too much, but just I think sometimes it's helpful if this is not a space you're in, like what we think about. And of course, obviously in the question section, love to hear feedback or experiences that others have. So I'm going to start with supports, which is really, we think about government supports. One of the things that was really important for us is when we started, the state of Pennsylvania required IQ testing and adaptive behavior assessment and an autism diagnostic assessment within 12 months of when they were applying for a Medicaid waiver. And if I say that out loud, I can't see any faces in this mode, but I'm sure a lot of people would be pretty shocked because how many families get a diagnosis in early childhood, or elementary school, and they're not necessarily redoing an ADOS or a CARS or something else to like re-demonstrate that they still have a diagnosis. So that's where we started, and that shifted, which also, now it's basically any testing after age 8, and then the adaptive testing, they want that within 24 months. So that sort of shifted part of the shift to our current model where what we're doing. But it's really important. A lot of people in our communities really don't understand waivers, know what they do. So we really like to sort of talk about like how they started that process. And this is really different from state to state of like how people qualify or like what money is available. So, we've spent a lot of time, and I want to give a great shout out to Dr. Garagozo, who really brought together so much knowledge from just different experiences she had in her training and in other venues, and just sort of brought this together for our team, of really being able to help begin to document, for families Medicaid waivers, helping them understand more about Social Security income, supplemental security income, because sometimes people have it for their child before age 18 and they don't recognize they have to reapply once their child is 18. Or some people didn't qualify when their child was under 18, but then could qualify as an adult. We talk a lot about ABLE accounts, special needs trusts. We talk about power of attorney and guardianship, and we talk about the Office of Vocational Rehabilitation for those who are considering working. Um, so again, these are things that I think if those of you that are working in this space, you're probably well versed and know about this. But it's obviously a key piece for us. The next question we tackle is like, what do you do? And for us, that's really thinking about education and employment. So we talk about college programs, we talk about accommodation requests, we talk about employment accommodation requests. We also talk about what resources and networks, within our area that may help support jobs. And I want to highlight in the college autism support programs, this is really broadened and I think we've been really excited in recent years to see that there is not only an increase in autism specific support programs at universities in our area, but there's also an increase in non-degree seeking, but college experience opportunities on campuses for people with ID. And so that's been a really nice thing. And because there are some families that come in and they say, my child isn't going to go for a degree, but I'm worried about going to a rehabilitation program where I was told it'll be anyone from 21 to 50, 21 to 60. My child's not with other people their age, and really concerned about that. So, and also relating that their child really enjoys a learning environment. So the fact that there are more opportunities to be involved in a college campus where they can be around same age people has been really nice, and being able to offer some of those opportunities. So I just wanted to highlight that as something that has been great. We talk a lot, this is a big category, how do you live? It covers a number of domains. I'm only going to have a few here. So we talk a lot about daily living skills. You'll hear more about that later as well in the research area. But we talk about skills for independence. We have a great partner in occupational therapy where we can make a direct referral to her and she works with our patients specifically, which is great. And then we also have a clinical trial for sort of enhancing people's motivation for daily living skills. So if you know how to do a skill, but you just kind of struggle to do it consistently, we've got a trial that's sort of using different approaches to sort of enhancing that motivation. And the other skills that we tap into here is we will talk about areas around guardianship in this space. We'll talk about transportation. So here's our transportation slide. We're sort of fortunate, at least for now. I'm a little nervous. We're expecting some city cuts, some pretty heavy ones to our public transit come January 1. But our public transit has a program where they have 2 occupational therapists that will teach, traveling on SEPTA, which is both buses and trains in the city and into the suburbs, which has been fantastic to recommend to families. Obviously we think about driving evaluations and specialized instructors to support driving. We talk about resources for ride sharing. And then also there's just some great general transportation toolkits for taking an airplane or doing other types of forms of transportation, riding a train. So those are the things that we'll cover to understand how somebody may want to transport themselves and what kind of supports they might need to do so. All right. Who do you spend time with? So this is a fun area. We think about connecting people both to neurodivergent communities if they're not connected and they're interested. We also just think about and have developed some resources around connecting for their interests. Because some people say hey, look, I'm a big Eagles fan. I mean, I'm not personally, but I live in Philadelphia. A lot of people are, and they're like, I want to connect with people that do this or do this woodworking thing. And it's sort of irrelevant if the people that they're connecting with are neurodivergent or not. So we want to be able to, we don't want to funnel people to only connecting to neurodivergent communities. We also think a lot about both virtual and in-person opportunities based on people's needs. And we also talk about, goals for around platonic and romantic relationships. And this is a special interest of Dr. Garagozzo. And so there's lots of work happening there that I'll touch on a little bit later. in our guiding model now, the one of the last areas is we talk about how do you feel. Actually, this is our last area. I've done all the others. We talk about how do you feel, and this is really about medical and mental health care for us. So within our system, we have a team that's called the Adult Care Transition Team or the ACT team, and they support people that any patient that is considered medically complex, which is you attend 3 or more specialties at CHOP. They will help you sort of do that transition from medical care. And we partner with them. They do some psychosocial transition, which is what I really consider us to be focused on. But they do quite a lot. So we're really taking people that don't have that medical complexity. So if they need to, have neurology and GI and sleep and cardio, like then they really work with the other team. But for us, we really focus on adult primary care, which is a pretty significant barrier in our area. I don't know if others experience that, but it's been, like every time we identify a new provider, it's sort of like, you've uncovered like the needle in the haystack. And then also providing mental health support. This is actually an area both in research and clinically that our group is interested in and led by Dr. Kaplan Khan. So that's an area that we really try to focus on, given that this age range is both a lifetime high for the population for, depression and suicidal behavior, but there's also lots of great research in the field highlighting that the autism population is elevated quite significantly relative to the general population. So really, I think that's an important focus, not just for our program, but for the field. Um, so this is what that sort of like map that we step through in our assessment, which we spend about 90 minutes to 2 hours doing. And if people ever want to talk about, getting down to brass tacks of billing, we're happy to do that. It's a evolving, cycle of like how you go about doing that. And I'm sure anyone that's clinically engaged understands that. Um, so now I'm going to switch and talk about our training and education resources. And we sort of see it as this arm is sort of having two foci. One is connecting directly with the community, whether that's autistic people or their loved ones, and then also thinking about the next generation of leaders across a variety of fields. And so right now, so one thing I'll talk about is this whole program and initiative, we really do try to consistently engage with the community. We created a priority setting meeting, which I will just sort of highlight one aspect of it. And this was led by Dr. Kaplan Khan, which was so well received in the community. I think Susanna Reimer and I was just so thrilled when she took this on and led this meeting. Really talking about what are their priorities within, like, what do you want providers to know? What do you want information coming back to you? What do you want to see research on? What do you want to see in your clinical care? And then we've been able to fund and support 2 postdocs, actually 3 postdocs now. Dr. Meredith Kohler is our third person, and I just realized I didn't have her picture up. I should have had that. I apologize, Meredith. We're also doing didactics for psychiatry fellows, and they're starting to rotate with Dr. Katz, our psychiatrist, who's with us about a day a week. And we've been talking with the Meds Peds Fellowship track director, and starting next fiscal year, July 1 of next year, they're actually going to start to rotate both with Dr. Katz in some of the multidisciplinary evaluations so that Meds Peds fellows can start to see how we talk about transition to adulthood care. And we're really excited about this because from our perspective, these are going to be the right people who can start to provide like primary care for our population. And so we're just so fortunate that we have a training director who's across CHOP and Penn who agrees and is really excited about supporting that element in Meds Peds fellows. And this is like internal medicine peds. So we're just excited to partner with her and that program to really make that a reality. Because at least from our point of view, like we really need more primary care doctors who are comfortable serving our families. Building on a long-standing practice at the Center for Autism Research, we also carry out Next Steps into Adulthood workshop, which really are supported by that center, which is where I came in and I'm still part of, very much so. But these workshops We have them for younger ages, it's really directed at families, but in the adulthood workshop, it's always been focused on adults. So there's an adult component and then there's a caregiver component. And then in the adult component, we've long had like autistic individuals sort of talking about adulthood and what does it mean to be an adult and what is adulting? And it's so fantastic to see our partners lead those workshops. Um, and then of course in the caregiver one, it's really focused on some of the things we talked about in that guiding model. Those we have people coming in from those fields. So we have somebody who does financial management and sort of specializes in what they like to call a retirement for three, for thinking about people that are going to need support. Coming in and talking about, how to like a special needs trust and how do you sort of think about, strategizing, financial resources where you can. We also have people coming in and talking about government services and college accommodations, work accommodations. It's really sort of trying to bring that to life for families, which we're really excited about. Um, Everything we're excited about. I think I just say that a lot. So just to touch briefly on the priority setting meeting, um, we had 30 advocates attend, and they were really split, as you saw on the last slide. It was, people that identified as autistic. It was caregivers. It was people running nonprofits. It was providers, and honestly, being very people cross multiple categories. There were parents who also identify as autistic. They were running nonprofits. They were therapists. They were doctors. It was a fantastic group. And we provided an overview of what we were thinking for Passage. We sort of described it to them as like, if we're building a house, this is like the wood, like we've got the frame, but like we need you to help us understand what's going to be important to fill it out. Because we didn't want nothing because we thought that would be overwhelming, but we didn't want to have something so finalized that people would feel like, why are you asking me? It feels like you're asking me so that I could just say yes. So really we wanted to have it open. And just to give you an idea, like we would ask people, we break people out into subgroups. So the 30 got into groups of 10. And we sort of did like a modified Delphi procedure of rounds of voting where people in those breakout groups would generate what are the topics. So what you're seeing here is an example of the clinical, where we said if we could provide assessments, here's some different things that we could offer. And we gave a range of things and then asked them to generate other things that weren't there. And then after that, we had people vote, and I think we probably started with like 20 or so topics. And then we got down to 10. And then we did a second round to saying, okay, so like these were top 10, now vote again. And then we sort of let them know that we were going to try to emphasize like the top three, top five. Those would be the things that we would try to achieve over the next 3-year period. And you can see from our priority setting meeting, the transition assessments that I talked about, that was something we had a pretty good idea about because of talking with the community. And again, like it was not a surprise that that came out number one for us. But there was also quite a bit of emphasis on wanting diagnostics for first-time evaluations or re-evaluations because of questions, because of so many people feeling like, well, somebody said it, and then somebody said no, and then and just having this really confusing diagnostic journey. So being able to have a place to come back to, even if you were 18, 22, 24. So that's really where we started from. All right, so for the last 10, 15 minutes, I'm going to try to talk about our research program. So our goal, like I said, was to generate the knowledge, but we really, when I was approached, because my work, and you'll see some of it in a second, was really moving in the direction of wanting to be more translation aware. Like when I got to the end of a project, I was going to have something tangible to bring right back to clinical practice or my recommendations and my reports. And when I was approached to talk about maybe taking on a program like this, I actually thought it was really important that this specific program needed to have that as like a required element. Because I think I'd heard too many times from the families I worked with that they needed something right away. That like waiting 10 years to know that there's going to be something to help them, or 15 years, or that, David Mendel talks about the 17-year gap between creating an intervention and then it being in a community practice. People felt like that's too long, like I need something faster. So we really built that into the ethos of the program. And so the topics that we're covering, and I'm only going to focus on daily living skills just out of time. And it's also to be fair, it's also our most developed area. Others are in earlier stages, but thinking about daily living skills, thinking about understanding quality of life, and how do we measure it carefully and thoughtfully across people, across the cognitive spectrum. Um, which is that work is really led by Dr. Kaplan Khan, along with mental health work. Um, Dating for autistic people with ID. This is led by Dr. Garagozo, coming up with a program to help support that and support communication between, caregivers and the young adult who wants to date. And then also work I've done with Dr. Curry around transportation. Um, so these are sort of areas that are part of this program. Also, and I didn't put this on there, another knock on me. But we also have some, emerging work about thinking about, like healthy lifestyles as well. And wanting to understand, for people that may be wanting to make changes in diet, and eating. But I'm going to focus on daily living skills because, like I said, this is the most developed area, and I can really show hopefully a nice cycle across the different portions of our program. So, daily living skills are really important around independence. And the way we think about it is, our group and my work with Lauren Kenworthy and Greg Wallace, for years, we've shown that there's some links between attention and executive function with daily living skills. And more recently, one of our collaborators who was with Lauren Kenworthy, but now is a program officer at NIMH, Kara Lacey, linked self-determination to daily living skills. And that was a really important, we feel like these have been important skills that seem to be related, and others have done this work as well. In working with one of our partners, as we were starting to uh, develop a measure that could really capture daily living skills when you're thinking about supporting people into adulthood. I mean, we've got some great measures, right? We've got our ABAS, we've got our Vineland, but largely those measures are targeting people with an intellectual disability, and there's just sort of a natural ceiling as you get to thinking about adulthood, like what makes somebody a 120 in daily living skills? Is that the person that writes thank you notes like right after? Is that the person that makes their bed every day versus the person that does it twice a week? So I think we felt like there was some ceiling there, and we were able to get some foundation support to sort of try to understand what are the priorities for autistic people that they feel like they need. And that's something that we learned, sort of. I should say that we learned what they thought was a priority to help us build a measure to understand that going into treatment. And one of the things that came up with our partner, our autistic collaborator, is they brought up this idea that there's a lot of skills that they need help developing or they might need support with, throughout their lifetime. But there's also a lot of skills that they know how to do, but they really just kind of struggle to do them when they need to. And so it really got into this idea of motivation. And obviously motivation, whether you're talking about social motivation or motivation for, other domains of life, we've seen that that can be challenging for many people on the spectrum. And so we sort of felt like that may actually be a really important component here. And that, sort of underlying skills, motivation, and I think really are drivers for having effective daily living skills. So that way you can live as independent as you desire, you can advocate for the supports that you want, and then hopefully are moving you towards a higher quality of life. One thing I want to point out, because I've been asked this question before, people talk a lot about opportunities for daily living skills. Sometimes those opportunities aren't afforded to our teens and young adults. And I want to highlight that we capture that. That's actually part of our definition within self-determination. It's having the capacity to set your own goals and then also having the opportunity to go ahead and do those. So within projects that we have under the umbrella of daily living skills, I sort of already hinted at this idea that we were developing a new daily living skills assessment, which over the last 36 hours, I'm calling Interview for Daily Living Skills. And the goal here is really to help people inform us like as we're thinking of going into treatment, if you want to work on certain skills or certain areas are important to you, what's the barrier? Is it that you don't, you need to learn the skill? Is it improving or enhancing your motivation? Like you know how to do it, you're just not doing it as often as you think you should or you want to do. And then also understanding if there's an opportunity block there. And so that's what we're sort of building out. Um, and what's actually of importance, I wanted to highlight this. So I said, like, we interviewed people trying to understand what matters for autistic adults, what for caregivers. What was really interesting is the domains were quite overlapping across adults, autistic adults, and then caregivers. But some of the specifics were actually non-overlapping. So what's highlighted here, and I don't expect you to read all of this. I'm not sure if it's big enough to read, but just to highlight that there were some unique things that autistic adults talked to us about. So one was self-care. So they brought up exercising. They brought up being more independent with medication management. They brought up money management. Um, in care for others was a domain that did not come up for caregivers, but did come up for autistic adults, specifically about if part of their role is to take care of other family members or being a parent. Thinking about that as a daily living skill. And what came up quite often was also taking care of pets and being a pet owner. Um, and this was really exciting for us because when we create this interview, when we start asking about domains, we want to make sure we're focusing on the skills that matter. So after they created these and they sort of talked about what was most important, these were the top three: managing finances, getting places independently, so transportation, whether driving or not driving, and then honestly taking care of a pet was a really high one. And we don't normally talk about that in daily living skills, but it makes a lot of sense that this would be something you would put onto this category. Um, so I sort of feel like this is a great microcosm for Passage, right? So we determined from our clinical work that we wanted a pretreatment measure to know where people should funnel, and we needed some sort of measure to really capture these different components. So then we took that question, brought it to our collaborative research team, and this has been an awesome collaboration. This is not just Passage at CHOP, but this is us working with Amy Duncan, who's fantastic, working with Lauren Kenworthy and Greg Wallace, and while we could, before she joined NIMH, Cara Pugliese. It's been a great experience. And Brenna Maddox, I shouldn't forget Brenna as well. And then, when we're done, we will have this interview, this tool that we would want to disseminate both the results of what actually matters for autistic adults in their daily living skills, what they see as being a top skill. And then we could be able to share the interview with a wide variety of professionals because it's not just one, um, field that's supporting daily living skills, right? You've got Amy Duncan doing straw, and you've got occupational therapists, doing hand over hand. You've got ABA therapists using, other behavioral approaches, using behavioral approaches along OT. There's just so many different people. So we would love to get this in the hands of as many people as possible. So hopefully this highlights like where we're trying to like bring this together to have something tangible. All right. The oh right. So the next area is we wanted to understand what factors may really contribute, and I highlighted, we believe underlying skills are EF, self-determination, and even motivation. But to be fair, all of our research, not all, almost all of our research is cross-sectional. So we were able to get so this is the model again, just highlighting it. We were able to get a grant from NIMH. And after much wrangling in the last year, we were able to get our non-competitive renewal. And the goal is really to do a longitudinal study with 3 time points, and at least one of the time points is them when they've left secondary education or a transition program that is sponsored by the school district, so that we're really getting them at least one time point out in adult services. And we're trying to show sort of a predictive or causal role for executive function, for self-determination, because these would be skills that we would want to think about, like whether we're partnering with any number of people around, maybe adapting or sort of bringing pieces together. Because in terms of treatment of, if EF is playing a predictive role for daily living skills, you can imagine that there is a world where you may want to do an executive function treatment either embedded within a daily living skills treatment, or you'd want to have executive function supports, or you may want to do an EF treatment ahead of and do it like in sequencing, like a smart design, like if somebody really needs EF supports in a certain area, they sort of get that support and then they do the daily living skills training. Same thing for self-determination. I think there's great work out there showing that both of those skills are malleable. And so I think this is a really exciting opportunity of a pre-services grant to then have an influence. Um, so this is work that we're carrying out right now. We're in year 3. I'm not presenting any data from it. I did submit for INSAR, but I'm just holding off until we have slightly more people in the sample. I mentioned earlier our work on daily living skills. So we've done some work. I've done some work in looking at neural basis of motivation differences, and for a long time I had this idea of wanting to apply motivational interviewing in the context of autism. I just always felt like it would be so nice to empower people to find their reasons, their motivation, their drive for making a change in behavior, and also being focused on the behaviors that they choose to change and work towards. So we got an internal grant from CHOP to sort of develop this treatment, and Dr. Garagozzo was a force in this particular work, developing the initial manual, but this was also great collaborations with Dr. Gettings, who's our MI expert, which is what we brought in, MI techniques, and Dr. Kushner, who's sort of within CAR, sort of our treatment expert. And so we created a 5-session treatment where we identify a skill and we use MI techniques to help people start to connect and then sort of plan around how they're going to be more consistent with the skill that they know how to do. We only had 10 people in our initial feasibility study, but this is on a 7-point scale. So you can see that they had quite high ratings for satisfaction, helpfulness, strategies for targets. And this was for young adults, teens and young adults, like 16 to 21. And we were really encouraged by this. This treatment does have like a role for an important person in it. In the feasibility trial, we didn't, but we're following up with our DiEM trial, which is sort of expanding out from that, where we continue to have that MI-inspired intrinsic motivation condition. But when we were thinking about comparisons, Dr. Kushner really was, is inspired and really interested in thinking about most designs and having sort of, really trying to pull out different pieces. And when we started thinking about a comparison to treatment as usual, we really felt like that's a lot of behavioral techniques or a lot of extrinsic motivation. So that really led us to this really fantastic idea, and to this collaborative group, with the people I mentioned, plus Dr. Kaplan Khan is also involved in this research of doing intrinsic motivation as sort of an extrinsic motivation, which is just using a lot of behavioral techniques and self-reward programs. I think all of us have the experience of saying, if I work out 3 times this week, I'll get myself that new workout shirt or shorts that I like. And then doing a version where they're combined. And our goal in this efficacy trial, where we're going to have 30 people randomized to one of the 3 treatments, is to see, like, is there some evidence of efficacy? If so, we're measuring some factors that might be important for predicting outcome, like just different factors, whether it's mental health or other sort of features or traits of autism may be predictive of treatment. And hopefully we will take this forward into a larger clinical trial. I'm almost done, Steve, I promise. So then the last thing is just looking at how do daily living skills promote quality of life. So coming back to this R01, the sort of one of the key aims is looking at how daily living skills will then predict future quality of life. Because ultimately, I think all of the work we're doing, whether we're focused on daily living skills, mental health, dating, all of this is about just helping people achieve a quality of life that they're happier with. And we know from great research by Dr. Kaplan Khan and Dr. Judy Miller, who's here, and Laura Graham Holmes and others, quality of life is lower for the autism population. So I think, working towards identifying factors that can promote better quality of life seems like a very important mission for our group, where we're trying to, serve people as they move into adulthood. So just in the summary, I didn't say this, but this is really an evolving attempt to create a standard of care, because we've got standards of care, whether you like them or not. But there are standards of like universal screening, making a diagnosis. But there really isn't a standard of care of like what we should say we should be doing as people enter adulthood. And so this is our attempt. By no means is it perfect. We are always learning and adapting, and it's been a great process. I've had so much growth in this from working with my team and learning from the community. Um, our success, I think, is really rooted in the multidisciplinary care and the partnership. And hopefully you can see how our daily living skills work crosses all three arms, and that's really a template for what, other people within our research group are trying to do across these other topics that we're covering. These are our funders, these are collaborators that are not at CHOP who have just been fantastic to work with. And I'm going to stop there. I've left 9 minutes, which is great because it's 8 more than I usually do. I'm going to escape and stop sharing.
You can see our faces.
All right.
That was great time management, by the way.
Thanks. Hopefully
Great,
my New
great
York like
attention.
fast paced that speaking cadence wasn't
Oh, that's fine. My computer crashed like a third of the way into your talk, and I got it back about two-thirds of the way of it. It just decided to update firmware for some reason, so I missed a portion of it in there. I apologize for that. So, but I'm going to ask a question that you might have answered during the time that I was crashed.
sure.
Um, I'm just really curious, whenever any of us do this kind of work, we talk about quality of life and like bettering their lives. And, especially with today's movements and neurodiversity, they're incredibly valid. I just wanted to hear you just talk for a minute or two about your approach to how do you consider appropriately measuring, assessing quality of life of the individuals that you're serving?
Ah, Steve, you asked a great question. So this is a topic that uh, Ellie, I keep saying Dr. Kapakan because I always want to give people their honorifics. But one that she is particularly focused on of how we measure it, and I think it's both subjective and the objective markers. Um, I believe we ask questions, and Ellie has had funding and has a paper coming out of how she has worked towards making it more accessible for people with more cognitive or language limitations to start to ask those questions of your quality of life. I think it is about getting into questions around life satisfaction and feeling like you have a purpose and measuring emotional distress and mental health. And I think it is about those pieces combined with also understanding if people are um, also having some of those key objective pieces of like, are they living in a safe space? Are they, if they want to work, are they able to work? And I think one of the biggest problems that we have in the field of quality of life is that we don't have any way of those two being integrated, which is a topic that Ellie and I are both, with some other collaborators, very interested in wanting to pursue. Because I think if you just measure subjective or you just measure objective, you're not getting the full picture. And I don't know, and I don't want to say which one should be weighted more. I made a comment earlier about, maybe a difference of opinion of what matters more between program at NIH. And this is going back 4 or 5 years, so nothing recent. I don't know if there's any change there. I would imagine not. Um, but and our bias towards subjective. But I think both are really important because I think it's great if somebody's working. I think it's great if somebody is happy, but I think we want to know if those two things are combined together for a person. Because I think that's what we want to get people to be as independent as they want to be, and that may or may not be full-time work. And we want them to also feel like they're not, that doing those things in their daily life is not pushing them towards a level of burnout that then somebody ends up in significant distress. So I think, I mean, we can talk, if you want to talk specifically about measures, we're using a lot of measures that other people are using, but I think there is a need to try to find a way to integrate these two components together because I think you're missing an important piece of the picture if you just get subjective and you don't understand what the objective sides are. Oh, Steve, you're muted.
I said I totally agree. And I don't know, it's always this challenge and attention in the field in total, and attention as a parent, of a teenager who, is like subjectively they're unhappy, but they have to go to work, So how do you, there's the societal pressures of being, contributors to society in a way in the world that we live in today, even though it's not built for many neurodivergent people. So how do we, balance that with their needs and their happiness, but still the reality of having a job and taking care of people. It's just really hard area I found. So
Now I'm talking without me unmuting. I completely agree. And I think there is an element of um, as you reach adulthood, you start to realize how the rubber meets the road of it isn't all roses. I'm not going to have everything planned. And I think to be fair, I think sometimes we are unfair to our populations of, on the autism spectrum or IDD with or without autism, where we start saying, well, you're going to need a job, so you're going to go to OVR, and what job do you want to do? And I sort of feel like if this was an 18-year-old or a 20-year-old who did not have any of those diagnoses, and they just said like, oh, I'm going to college, you'd be like, great. Like you'd be like, great, like, and maybe you might ask them what their major is. But like it's sort of like that's going according to a plan where we don't have this intensity of
Yeah.
questioning. And I feel like sometimes we have too high of an expectation. That's not fair. Like,
Yeah.
and sometimes I have teens coming in and a lot of distress is around, well, I don't know how to pay my taxes. I don't know how to do that. I don't know how to get a
What
mortgage.
he does.
Right, right. And it's just like, okay, so like there's H&R Block, and it's like, how much of those things are you truly independent where you're doing all of that by yourself? And I do think there is an element of just helping people be comfortable with, this is probably going to sound somewhat Buddhist, and I don't intend it to be, but being comfortable with the uncomfortable, being comfortable with living in gray, which is really hard for everybody. Um, and I think knowing that that's just the experience for everybody, that not everybody knows right out of the gate when they get into college, when they graduate, what their path is going to be, or what they're going to do, or how they're going to pay for everything. Like being okay that you don't have all those answers. And I think that's
God knows I'm the poster child for that.
right. Right. Well, I mean, I think we all are. And I think um as somebody that's in mid-career, I think about sharing that transparency with my patients, with my trainees. I was having a conversation yesterday where we were we have a family that we were struggling with of trying to serve their needs, and trainees were talking about feeling the stress of seeing them, like the unhappy message from the family, and I was like, don't get me wrong, like I have a plan. My heart still flutters. My heart still races. Like I still have to engage in some management of that, and I think that's true, so like when I get something from the IRS saying like something's come up, like I get stressed out about how that works. And I think just sort of sharing that with teens and trying to find ways to have that conversation is important. So anyway, yeah, I think that's true, Steve. And I think we need that not just for our for the autism population, but for everyone. Um,
Karen
um,
just wrote, do you know of any parenting resources for parents with IDD ASD?
that is a great question. I don't have something I can give you right off the top of my head, but I will take a look. I feel like there's some great stuff. I mean, one of the best I would say, and I don't know if it's publicly available yet, but Julie Lowndes Taylor has been doing this work with the Assist program, which is a training, and she's done it by webinars and she's done it in person. And I don't know if she's putting the materials online. Steve, you're nodding, so maybe if she's got it online or not. But like
For
that
sure, I know
program,
her work.
when
Yeah.
she's presented on it, I have been so impressed. It's fantastic. So I would really look into that and maybe even just reach out to her. Julie's fantastic, and tends to be pretty open.
Well, again, you can see why I wanted Ben to come present. Fantastic job, Ben. I really, really appreciate your passion in this area and moving this forward. Again,
Thanks.
next month in November, so November and December, we're probably going to move it up a week. So it won't be the last Wednesday of the month. It will be the third Wednesday of the month. We'll send out on the listserv, reminders about that just because of the holidays. We want as many people to be able to attend as they can. But we have Jim Ray coming next month to talk about his incredible work on video analysis stuff, which is super cool, by the way. And I am geeking out, yes. And then Matt Goodwin in December talking about wearables. So yeah, you should have already received an email about the updated times. We'll hit people again up with that. But Ben, thank you so much again. I hope everyone has a wonderful rest of the month and a good November until we see you before Thanksgiving.
Happy Halloween, everyone.
Thanks, everybody. Bye bye.